Today I'll be showing you a fun workout with Thera-Bands. So today I created a workout for you concentrating on hips down using these Thera-Bands. So what you want to do is grab your knee and pull it as close to your chest as possible. And then we're just pulling it to your chest. And you're incorporating walking with it. And make sure to get a good hold on your knee. And then you could always go back too, so I'll do that. So, and I usually hold it for about 1 or 2 seconds. Next warm up is my walking foot grab. What we're doing is we're grabbing your foot and trying to get that foot all the way to your glute. And again, we're walking with it. We're holding it for about 1 or 2 seconds. And we're just taking 10 steps. And it gets that quad to stretch. This next warm up I call drinking bird. Then some people call it RDLs too. So what we're gonna do, I'm gonna show you the side angle. We're gonna balance on one foot and then just reaching straight down and then getting that the leg lifted off, the opposite leg lifted off. So you're planting one foot, and then we're gonna straighten that leg with our back, make it parallel, and then we're just gonna alternate. And like I said, I don't have perfect balance, so you'll see me wiggling throughout the video. But yeah, it gets a good muscle stretch in your hamstrings. And then modification, I guess do it near a wall, so if you are wiggling, you can catch yourself. So we're gonna go into the workout with the Thera-Bands. So my first workout is hip abductions, and we're gonna use the Thera-Bands for that. So hip abductions, what I like to do is I'll grab the Thera-Band and then I'll bring it around both my feet like so, and the Thera-Bands will be around my ankles. So for this first exercise, it's called hip adduction. So adducting means taking away. So what you're gonna do is lift your foot like that. So you're lifting your foot away from your midline. Your midline is the middle of yourself. And we're just lifting. We're gonna do 10 sets of these. So 6, 7, 8, 9, 10. So this is the hip abduction movement. You can go close to your foot, or if you want more of a challenge, you'll go across. And then make sure not bend the knee. We're keeping our legs straight. So we're gonna do 10 of these as well again. And then if you do need modification, you can get a chair or you can hold on to the wall. And we're just going for 10. Take our foot and go forward, keeping your leg straight, making sure not to bend the knee, we're it's like kicking a ball. So just pretend we're kicking a ball, and we're gonna extend as far as we can to get that muscle moving. And then we're gonna take the motion to the back. And then just make sure, again, you're keeping that leg straight, that is extending out. And making sure your posture is correct, no slouching. And we're going for 10 again. 8, 9, 10. And we're gonna put it around above our knee. So then we're gonna, like I said, get in that RDL position, and then just have the tension around the knees, and then extending that leg out. And then I'll show you front view, because it's balancing on your foot. So I want to show you that balance effect. And as you can see, I'm not the perfect person with balance, but I try. So if you can see in the video, I'm probably kind of wiggling. So we're doing that for 10 again. Okay, then another one we're gonna do is squats. So again, bands around the knees. We're just gonna dip down. We're dipping, and that should help with the hip. It's gonna put resistance against the hip abductors on that. Another thing too about this is you'll feel it with the band. So say this is your first time doing this. When you go down, sometimes your knee will want to come in, but the trick for this, the Thera-Band's creating the resistance. So when you're going down, you're gonna want to drive your knees out. So when I squat down, you'll see I'm driving my knees out. I remember doing this the first time, my knees would cave in because of the resistance. So we're going for 10 on these. And then I'll show you the side view again. Make sure to have your back straight, you're not slouching, and then get your butt down as far as you can go. And then just going for 10 again on those. So what we're doing is we're gonna take like a diagonal forward step, and then we're gonna do the opposite with the other foot, and then it's just walking down, your 10 steps, and then when you reach that 10, stay in that position, and then we can go backwards. So going backwards is just just going to be walking back in a back motion, and then making sure your foot, each foot gets that diagonal reach. And we are doing this for 10 again. All right. So my last one is called the lateral bandwalk. We're doing like almost a whole squat, like a partial squat. You'll feel the tension on the band. So it's gonna make you want to drive your knees out again. Then after that, we're gonna clasp our hands together and then just walk down a clear pathway again. Enough for 10 steps. So once you hit that, you're gonna go back the other way, and it's working for those. It's working your glutes and also the abductors again. And it's putting the tension on the abductors. Okay.